Good afternoon, everyone. My name is Adilene Garcia, and I am the director of the Janus Center for Youth in Crisis with the Council of Churches of Greater Bridgeport. And we are located in Bridgeport, Connecticut, for those who don't know. We have been a program focusing on youth, runaway at-risk homeless youth, as well as working within the schools to be able to serve our youth and provide mentorship, but also provide them support, social emotional support throughout the year, and refer them as needed to various resources throughout the community of Bridgeport. We also work with our community partners to ensure safety of our youth from the community. And we have our host home program that provides respite care for youth within the community of Bridgeport, where our youth can stay up to 21 days in our host home model that we have as well. So today we're here to talk to you guys about the importance of mental health. We have our three Janus Center interns, Jordan Moding, Julianna and Telecia Dobson, who are going to be talking about the importance of your mental health. So whether you're a youth who is wondering about ways to encounter the mental health that you may be experiencing, looking for resources, or you're also a provider who works with youth who may have mental health issues, stay tuned, and we're excited to share what we have about mental health, and we're excited for you guys to learn more. So I'm going to turn it over to Jordan to kick us off with the importance of your mental health.
Good afternoon, everybody. Like Eddie said, we're here to just talk about how important it is to maintain your mental health and work through the different aspects of your life that interfere with your mental health. So with that, we'll just start with how hard it is to actually talk about mental health. But with that, we know that it's really important. So how should you start with opening up about your struggles in mental health? It's really all about you and your comfort level. So just remember that you're the expert in your own situation, and you get to decide ultimately who you get to tell and how you get to tell it. And this can just also give you some control over your mental health, because a lot of times when we struggle negatively with our mental health, it is because we feel like we have a loss of control. And it's normal to feel mixed feelings about this, but it's important to tell people that you trust, so that you can get that feedback and the positives out of sharing your mental health. And so some of the reasons that it's really important to confide in people that you trust about your mental health is to just receive some encouragement, to relieve some stress and improve your mood, to ask for help in finding treatment, to ask for transportation if you need it to get treatment, and to share your crisis plan if you have one.
Hi, I'm Juliana, and before we jump into it, I just wanted to share the definitions of health and mental health. So according to the World Health Organization, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And mental health is a state of well-being in which an individual realizes their own abilities, can cope with the normal stresses of life, can work productively, and is able to make a contribution to their community. So these statistics show that your mental health is truly so important, and that mental health disorders are very common, and you're not alone in what you're feeling or going through. So 1 in 5 children experience a mental health disorder, but half don't receive the treatment they need. And we'll dive into why this is in a later slide. Between 2009 and 2017, reported cases of major depression among teenagers ages 16 to 17 rose approximately 70%, and feelings of anxiety and hopelessness increased by 71% among individuals ages 17 to 25. And 1 out of 5 girls ages 12 to 17 had experienced major depression within the last year. The rise in mental health disorders among youth has shown a direct correlation in the increase in teen suicide, and recent data shows suicide as the second leading cause of death among teenagers ages 15 and 19. And as of 2017, the Centers for Disease Control reported that suicide rate among teenagers was 10.6 deaths for every 100,000 teenagers. And there are a number of factors in life that can affect your mental health. These factors can either pose a risk to your mental health or protect your mental health. These include self-esteem, feeling loved, bullying, stress, racism, poor physical health, busy schedules, and pressure to succeed, and so much more, as you can see here.
So some of the positive effects of coping with your mental health are reduced anxiety, improved moods, minimal negative thinking, a greater sense of calm or inner peace, increased self-esteem, reduced risk of depression, and improvements in relationships. So with that, it's really important that you're talking about your mental health and doing what you can to cope the best you know how with your mental health so that you can start to see an improvement in the way that you're feeling and the way that you're thinking. And then on the flip side, if you're not taking care of your mental health or coping with it the best that you know how, there's a variety of different things that you could face. Just continuing to feel sad or down, feeling withdrawn from your family and friends and different activities that you typically like to do, significant tiredness or fatigue, having low energy or troubles with sleeping, confused thinking or an inability to concentrate, major changes in eating habits, excessive fears or worries, and suicidal thinking. So, with that, you just want to make sure that you're dealing with your mental health, like I said, the best that you know how, because otherwise it does tend to get even worse and you'll start to exhibit even worse feelings like these ones. So, with not dealing with your mental health or starting to feel a change in your mental health, it's important that you really stay in touch with your feelings and recognize when you're not feeling your best and recognize when you start to feel different than you typically do when you're at your best. So, these are just some things that you might want to keep an eye on. And just this is, I guess, ways that you can start to recognize whether or not your mental health is declining or you might not be in the best mental state for yourself. So, uncontrollable feelings of sadness, reduced ability to think or concentrate, excessive worries or fear or guilt, extreme mood changes, withdrawal, no social interest, low energy, troubles with sleeping and abilities to cope, troubles with understanding different people, dependence on different substances, major changes in diet, excessive anger, hostility, feelings of wanting to hurt yourself or others, and feelings of wanting to die. And some ways to better your mental health. So if you are starting to feel like, those are some things that you're feeling or you're just not feeling your best, it's important to keep active, to talk about your feelings with someone that you love or you trust, to eat well and balanced in the things that make you feel good, to limit the use of substances like drugs and alcohol, keep in touch with your family and friends who make you feel good, and remember to ask for help when you need it. And then take breaks when you feel like you need it. Focus and use your time doing things that you enjoy. Set the small, achievable goals for yourself so that you can feel like you're accomplishing things and you're getting things done. Take a break from your screens is really important. And then try to get some fresh air as well.
So, stigma is a negative or often unfair social attitude attached to a person or group, often placing shame on them for perceived deficiency or difference to their existence. So, mental health stigma refers to societal disapproval or when society puts blame on individuals with a mental illness or those seeking help for emotional distress. Stigma against mental health can come from family, friends, coworkers, society on a broader level, and even yourself. And a lack of awareness, education, perception, and a fear of people with mental illness can all lead to an increased stigma. So, examples of stigma include media depictions where the villain is often a character with a mental illness, harmful stereotypes of people with mental illness. Stereotypes include people with depression are just lazy, or that people with mental illness are violent or dangerous. A small minority of people living with mental illness commit violent acts, and they are actually 10 times more likely to be victims of a crime, making them a vulnerable population we should be protecting instead of fearing. Treating mental health issues as if they're something that people can just overcome if they just try harder or snap out of it and using phrases like she's crazy or he's insane to describe people or their behavior. And then the effects of mental health stigma. There are a lot of negative effects of mental health stigma, as you can imagine, including many youth are uncomfortable talking about their mental health. Stigma around mental health puts adolescents at risk for not seeking help for themselves or helping their peers dealing with emotional distress. Nearly 9 out of 10 people with mental illness feel stigma and discrimination negatively impact their lives. Research has shown that stigma is one of the leading risk factors contributing to poor mental health outcomes. Stigma can make symptoms worse and can make it difficult for an individual to recover. And it can also lead to delays in treatment and reduces the likelihood that a person with a mental illness will receive appropriate and adequate care. And other negative effects include internalization of negative beliefs, social isolation, low self-esteem, hopelessness, shame, discrimination at work, and even unemployment. So how do we combat this stigma? We should remember that many people experience emotional distress and mental health disorders. We should educate ourselves and loved ones about our mental health, debunk myths about mental health disorders, and listen to and support others with mental health concerns.
And then this is just a quote going along with the stigma of mental health, because in order to get rid of a stigma, like Juliana was saying, we just really need to shed more light on mental health and have those conversations that are unshamed and show people that it's okay to talk about it.
And like Jordan was saying, asking for help is a big step, but it can also be very difficult to ask for help. Asking for help shows not weakness, but significant courage. And when you're ready, there's a lot of potential resources to turn to, though it might seem overwhelming at first. Options include a primary care doctor, in-person or online therapists, support groups, community mental health programs and clinics, employee assistance programs, student counseling centers, and national helplines. And then this is just a quote I saw that I really liked. It says, sometimes asking for help is the bravest move you can make. You don't have to go it alone.
So we've talked about a lot of different ways that you can recognize your own mental health deteriorating, or ways that you can help yourself if you see those changes. But it's also important, like we've mentioned, to know when to ask for help and to know when to get help. So with that, there's a bunch of resources within the community that you can utilize if you do feel this way and if you don't feel like you can go at it alone. So the Janus Center, obviously for youth in crisis, and we have a hotline 24 hours a day, 7 days a week, 365 days a year. If you need someone to talk to, if you're at the end of your rope and you don't feel like you can do it anymore, that's a crisis line that you can call. The national helpline, they're the same thing, open 24 hours a day, 365 days a year for English and Spanish. The Janus Center is the same. Some more resources continue. The REACH program through Yale New Haven is not a crisis line, but they're actually in-person services that you can go to if you need help. Same with Greater Bridgeport Community Mental Health Center and St. Vincent's Mental and Behavioral Health as well. And then these are just some hotlines that you can call if you are feeling like you need someone to talk to that's not your family or your friends. You just want someone who might know, have the skills that you need to talk you down, or just feel like there's hope. So National Suicide Prevention Lifeline, Substance Abuse and Mental Health Helpline, the RAIN Sexual Assault Hotline, Domestic Violence Hotline, LGBTQIA+ hotline, and then the Trevor Project hotline for LGBTQ youth. I think that's the end of our session.
Thank you, Jordan and Juliana, for really focusing on the youth and what resources there are out there. Most importantly, for highlighting the numbers that they can call, and also as a provider, what numbers are available for you all to call as well. It's important that we reiterate to you all, whether you're struggling or whether you know someone who is struggling, that they speak up and or that you speak up, because the only way to come out of situation that you're in is if you do talk about it and you do let someone know, someone that you trust know, to support you and to help you through it. Because just like the quotes that they mentioned today, you don't have to go through it alone. And it may feel like you're going through it alone, but as long as you really try to speak up about it and get that support, um, and the resources that you need, you will find that there's always a light at the end of the tunnel. So thank you all so much for tuning in today about discussing the importance of your mental health. With that being said, we do have our April session coming up, which we're going to be talking about healthy relationships and really the framework of creating those healthy relationships and sustaining those relationships among people that you have in your life. And being as a youth person, we will be discussing the stages of development and kind of what you will be feeling and what you navigate as a youth, and really identifying those positive relationships and keeping those positive relationships. So we thank you all on behalf of the Janus Center for tuning in today, and we hope to see you guys in our April series. Thank you.